Well, I was fortunate enough to live abroad in the UK for 6 months, and I thought their healthcare system was amazing, and I think something on par with what they do would be a perfect solution for what we have here. There still is, individual advancement and bonuses for doctors, so it's not like socialized and no one's going to care about working. And on top of that, regardless of who you are, you get treated, and it's only £6 for a prescription, regardless if you haven't. There is no insurance. I mean, everyone's covered by insurance, so if it's the most expensive stuff or it's the cheapest stuff, it's £6 flat rate, and that's pretty amazing.
Sure, I would make it more available to everyone, no matter what their economic status is.
I would shift it to prevention-based healthcare. So people would, I realize that this would be a major shift, but instead of treating, instead of it being based where you have a problem and then you treat it, people would really begin to think of their healthcare as something they need to maintain and prevent a lot of problems before they occur.
Obviously, I would like everyone to have health care, and I would like health care to be more affordable. And I think, honestly, I'd like less testing and unnecessary procedures.
Make it more accessible just to everybody, so that there isn't that gap of people who just have no access to health care. Essentially, that's it. I mean, I'm covered now, so yeah. I'm happy, but give it a couple years, yeah.
Certainly. I was listening, Vermont has the highest taxes of most states, I think of all states maybe even, and I was listening to NPR the other day, and Susan Bartlett, who's one of the Vermont State Senators from Lamoille County, was talking about how we have high taxes, but we also have a high quality living in Vermont, and we have great health benefits for just living here in such a great localized place. I don't have any problem paying 10% more and making sure that there's no medical issues for some people and debt and all these other problems that we have.
If it was well designed.
Well designed and evenly distributed.
Ditto.
Lose.
A little bit, yeah, probably.
Yeah. Probably.
The only thing that worries me about universal health care is the quality of the care, or maybe not the quality, as maybe you have to wait. You have cancer and you have to wait 6 months, to get what you need, and that's a concern. I know someone whose sister was in Canada, and actually she did have cancer, and she ended up coming to the United States to get treated and paying for it because obviously with her disease, she didn't want to wait. So that's the concern.
That they couldn't lose.
Yeah, definitely.
Yeah. Way that system could work out.
I think in any system like this, it can work out, but it takes time to work out the kinks and it takes time to figure out all the logistics of one of these systems. And do we have the time is the question, or should we just pull the plug on what we're doing right now and just switch over to something that gives everybody equal coverage? So I'd be more opposed to just pulling the plug. Not opposed. I'd be more willing to pull the plug and just start over. I don't see why we should waste another 10 years getting nowhere.
Okay. Yeah. Universal healthcare?
I think that kind of fuels the fire of the healthcare system as a business, and I think to veer away from that to contain costs and also to get healthcare more widely distributed. So I think that would be more detrimental as a whole.
Take better care of themselves and to be mindful of the way they eat, so that everyone's health care costs would drop, and we wouldn't need health care. That's what I really want.
Okay.
Plug for the alternatives here.
I was just saying universal.
I don't think it would work as well as people would probably still just be falling through the cracks, whether it's just based on their work or whatever, but I think universal is kind of